Thank you, everyone, for joining me today for our first JBI Roundtable with our author, Dr. Holly Marshall. Our article today that we're going to be discussing is Abbreviated Breast MRI, our 2-year initial experience that was published in Journal of Breast Imaging in June 2023 issue. I am delighted to introduce Dr. Holly Marshall, who is currently the Division Chief of Breast Imaging at University Hospitals Cleveland Medical Center, Case Western Reserve University. She's an associate professor of radiology. She graduated from Trinity College in Connecticut and attended medical school in Medical College of Ohio in Toledo. And her residency was completed at Metro Health Medical Center. Her fellowship in breast imaging was completed at Northwestern in Chicago. Dr. Marshall and her team have been offering abbreviated breast MRI since February of 2019. She has lectured and published several articles on this topic, and we're excited to have her here today. Thank you, Dr. Marshall, for joining us.
Well, thank you so much for having me.
So I want to jump right in. Can you just give us a brief summary of your study and the results?
Yes. So we looked at a retrospective review of our 2-year experience with abbreviated breast MRI. So in 2 years, we had 1,338 patients, and 83% received a BI-RADS category 1 or 2, and 9% received a BI-RADS category 3. 8% received a BI-RADS category 4 or 5. Our positive predictive value 2 was 14.2%, and our positive predictive value 3 was 18.5%. All cancers that we detected in the first 2 years were in women with heterogeneously dense or extremely dense breast tissue. Our cancer detection rate was 12 per 1,000. We found 16 cancers, and over a 12 to 24 month period, we had no interval cancers.
That is fantastic and actually very impressive. So, with your facility being one of the earlier academic institutions to adopt abbreviated breast MRI, what were some of the hurdles that you faced?
So we initially faced the hurdle of how we were going to have our patients pay for the study or get the study covered. And there is no CPT code to bill insurance for this study. So luckily at our institution, we were already offering screening studies such as lung cancer screening CT and prostate cancer screening. So the business office had already looked at the cost structure. So multiple meetings with the business office, it was decided that it would be a $250 out-of-pocket expense for the patient. So that was agreed upon with the business office. So that was one hurdle. So after we implemented the study, another hurdle, we looked at our results over a 3-month period, and we had a lot of category 3s. It was too high, so we decided to have a 45-minute meeting every other week to go over cases that were given a category 3, 4, or 5, and it was 8 radiologists, so we all looked at cases together, and we decided with looking at all the cases that from that point forward that everybody who we would think would get a category 3, 4, or 5, we would show it to 2 other radiologists for a consensus just to get our numbers where we wanted them. So those were a couple hurdles that we faced early on.
I really liked that intervention involving all the breast radiologists and coming together as a team. So what was the greatest challenge you faced in educating patients and providers about abbreviated breast MRI?
So we faced basically the hurdle of getting the word out. And we wanted to do that quickly because we wanted the enthusiasm and the momentum. So time was definitely a challenge. We met with our leadership team, which included the breast radiologists, the surgeons, medical oncologists, and radiation oncologists, and introduced the study that we were proposing to offer our patients. And after that, we gave grand rounds to primary care physicians as well as OBGYN. and we got the word out that way as well. We also created an intranet and internet presence for all the referring clinicians as well as patients. And we also created handouts to further get the word out, both for patients and for physicians.
That is fantastic. And I appreciate those tips, especially for those of us who are starting abbreviated breast MRI programs. Now, with abbreviated breast MRI, there's a lot of protocols out there. Has the results of your study changed your abbreviated breast MRI protocol?
No, we have kept the protocol the same. The only change that we have made overall is we're a large institution and we have multiple sites. We initially started with 7 sites and now we're 10 sites. So we've had to increase the number of slots and locations. But as far as the protocol, we've kept it the same. We did start off using our doing a stir sequence. I know that that's questionable and some people end up adding it, but we had it initially. So we had no reason to change our imaging protocol.
Fantastic. So to round out our interview today, what are 3 pieces of advice that you would give a new institution starting an abbreviated breast MRI service line?
So I definitely agree and would recommend to review your cases and do that early on. So we did it after 3 months and we had a lot of cases to actually go over. So I would definitely review after a couple months of offering the study with all the other breast radiologists in your group. So that's one piece of advice that I would give. Another is to really have the workflow down, because we offer the test and we say it's going to be 10 minutes and that's really the scanner time. So you want to make sure that that there's a workflow in place, bringing the patients back, the paperwork, the IV, and having that workflow in place, because 10 minutes. And so how we do it at our institution is we schedule 3 abbreviated breast MRIs in an hour slot. So it's a pretty fast workflow, a good workflow that needs to be really ironed out before you start to offer the study. And then the third piece of advice, I would definitely check the wait times to get an abbreviated breast MRI, because all of a sudden all of our slots were filled and we were 2 to 3 weeks out for offering the study. And we at university hospitals want to make sure that patients have quick access and are able to get the study in a timely fashion. So I would definitely make sure that you're watching the wait times to get the study.
Fantastic. Thank you so much, Dr. Marshall. This was a delight to have you on for our first roundtable. And again, this article was Abbreviated Breast MRI, our 2-year initial experience, published in the May-June 2023 issue of the Journal of Breast Imaging. I myself want to thank all of our viewers for joining us today. Please do not forget to follow the Journal of Breast Imaging on Twitter or X. Please also look out for our postings on Facebook and stay in touch. Thank you so much.
Thank you.
Ken, I need to